We thought we would start today's session. Can you all hear me okay?
Very well.
Okay, perfect. So we thought we would start today's session by sharing a story about a patient that I cared for with Dr. Edwards at our practice. And so this older gentleman, he was 82 years old when he came to see us, and he really didn't feel like he was having a memory problem, though he said sometimes maybe I just don't catch everything. And so Dr. Edwards talked to his wife, and his wife said, sometimes I tell him something and it's just like he doesn't pay attention to me, and then he can't remember what I said. Kind of really, really quickly, we were like, there seems to be something with the message getting to him. And so we did an in-office hearing screen. When we do the in-office hearing screen, it's just a little device that we put over your ear. The loudness of it is at the loudness of a conversation. And then there's 4 different pitches, so a low pitch and a very high pitch. And we ask if you can hear the tones in each of your ears. With this gentleman, he could only hear the very lowest of tones with the screening in the office. So we sent him to an audiologist, similar to Kendall, and he had his hearing evaluated. And lo and behold, he did need hearing aids. And once he got the hearing aids, he also started to have a better memory. He could hear now the messages coming to him, and thus he could record them and respond to things that his wife had told him. So we do know that hearing has a big impact on our ability to receive, record, and then retain a message. If your hearing is going down, so is your memory, not only because you don't hear the message, because of the part of the brain that's also stimulated. So Kendall's going to walk us through when we make a referral to an audiologist, what that's all about, and also talk to us about the research behind cognition and memory. Go ahead and take it away, Kendall.
Thanks, Shelly. It's great to be able to talk to y'all today. If y'all have any questions, you're more than welcome to unmute or throw them in the chat, whichever's easier for you. Talking about a couple things today, exactly what Shelly said, just a couple kind of basics about hearing health and what audiology is, looking at some of the new research regarding hearing loss and cognitive function, and then also in general, just kind of looking at what is a hearing aid and what would it do for me. So first things first, in terms of audiology, an audiologist has a doctorate in their field, and we are kind of the primary healthcare professionals for most things to do with your ears. Anything involving hearing and balance, from infants all the way to the elderly, we do all of it. And we can kind of work in a lot of different settings. We're in clinics, hospitals, schools, private practices, working with hearing aid manufacturers. We're a little bit of everywhere. So chances are, if you need an audiologist, there's one not too far away from you. So a hearing screening, which is what Shelly was describing, they did for that gentleman at his appointment. It is a kind of quick test to see if further evaluation is needed. So it's not really a diagnostic as much as it's just kind of trying to see if we need to send you for further testing. It is super useful to kind of either rule out a hearing loss or say, okay, we need to do some more testing here. But unfortunately, if you have the screening done at, an MMC appointment, they can't give you kind of the full information yet. You got to wait till we get you into a booth. And speaking of, when you come in for a hearing test, it is super easy. Promise there's nothing to it. We won't ask you to do anything hard. Basically, we start off by talking to you a little bit about any, hearing history you have, any symptoms you might have going on. We'll take a quick look in your ears just to make sure there aren't any physical issues that we need to worry about, a wax impaction or an ear infection, anything like that. And then we move on to kind of the testing portion. There's a little, soundproof room, and we basically play you different things. Some of it is speech, some of it is tones, and we either ask you to press a button when you hear it or repeat things back to us. So again, very simple. And After the test is done, we tend to do our math as we go. So basically, once we're done with testing, we have results for you and we will explain everything to you and talk about what our recommendations might be. Like I said earlier, there is definitely an audiologist somewhere near you within driving distance. If you are trying to figure out what your best bet would be or the best person, that's going to work for where you are and what you might be having issues with, we always recommend to talk to your primary care provider. If you have a checkup coming up, or even if you just want to shoot them a message like through the patient portal, you can say, having some trouble with my hearing, I wanted to get it evaluated, and they can put in an order for you to come see one of us. If you've had a screening at MMC, just like Shelly was talking about earlier, they can refer you as well. So again, we're around and we're easy to get to.
If I can interject, Kendall, oftentimes we recommend people go to Costco for their audiology exam because they have the audiologist there and the hearing aids are usually priced really well. So you'll oftentimes, if you're in the office getting a hearing screen with us, hear that suggestion. Also, if you are a Southminster resident, which we have quite a few of, they have Charlotte Speech and Hearing who's on site, but they also are available to others. So those are two that we oftentimes make referrals to.
Yeah, and I did a summer internship with Charlotte Speech and Hearing. They're great. They're awesome. The thing I typically counsel people in terms of kind of the big box stores is that, yes, for a long time they definitely had the best prices. So I mean, we would send people to like we diagnose and then send them there to actually get a hearing aid. But thankfully, especially with some changes in the market that I'll talk about a little bit later, we're kind of on par now. So a private practice is still going to run you a little bit more, like Charlotte Ear, Nose, and Throat is still likely a little bit pricier than Costco, but somewhere like Wake Forest Baptist, although you don't have to drive all the way there, or a more local hospital clinic, will be fairly, on the same page price wise. And the audiologist is doing the same thing. So if you see us, we're doing your diagnostic, we're working with you there, you get us the whole way. Another thing for the box stores is that sometimes you have a hearing instrument specialist, um, which are super helpful and can do a lot, but they uh, don't have the clinical degree. So Costco's a great option. Pretty much anywhere a provider will tell you, we don't care where you get it, we just want you to hear better. And speaking of, in terms of insurance, Medicare will almost always cover a full diagnostic hearing test. Um, Advantage plans sometimes cover additional testing or additional services, throwing in for hearing aids and things like that. But they're all a little different and they all change a lot and frequently. So it's worth calling or getting in touch with your Advantage plan and kind of seeing what they might offer. Now very basically, a hearing loss is a reduced ability to hear. And just like, with vision or glasses, we can go from I just need readers to I cannot see anything at all. So there's many, many levels of severity in between that. Some people can only have one ear affected. Most times they will have both ears, even though they can be slightly different from each other. And typically, hearing loss comes on very slowly. It's gradual, and as we know from other things, we can adapt to almost anything. So when it happens slowly, sometimes it's harder for us to catch it and to quite notice what's going on at first. Usually, it's about 3 years between someone first noticing an issue and actually making it in for testing. Um, and just to reiterate, there are many, many levels of severity. People can have a mild hearing loss and still struggle in some situations. People can have a profound hearing loss and, be struggling most of the time, and everything in between. So going to the audiologist does not mean they're going to tell you you're deaf. It just means we're going to see kind of where we are on that spectrum and what you need to be hearing better. So there are a couple different types of hearing loss. So just in case you go and they start using these words, you know what they mean. The first kind is what's called a conductive loss. So that's the kind where there is something physically blocking the sound from going through and hitting your organ of hearing. So that can be, an earwax buildup, a perforation of the eardrum, all kinds of different things. That's why we look in your ears before we do anything else. Um, this is very common in children. This is what we get when we have a kiddo with like a lot of ear infections and things like that. Typically, with older adults, we're getting something called a sensory neural hearing loss. And this is the type that is coming from damage to the organ of hearing itself or the nerve that connects the organ to the brain. It's the one we all get with time. Eventually, anyone living long enough gets this type of hearing loss, but also genetics, noise exposure, systemic conditions, certain things like diabetes and other things can, have an increased risk just due to changes with your body chemistry. So a lot of different things can go into this one, but that's the type we most usually see. And then you can have people with what we call a mixed hearing loss that has a little bit of both, maybe something physical as well as something up with the nerve. So there's a lot of different types. That's part of what we're trying to triangulate when we are diagnosing you at that first visit. So, in terms of cognition, there has been a lot in the news and in mailers and all kinds of stuff recently. I'm sure you kind of feel like this probably that it bombards you a little bit. Um, and all the titles are very catchy and eye-grabbing, but sometimes it's hard to figure out exactly what they're talking about. So basically, there have been several long-term studies that have recently kind of hit a conclusion or at least a midway point, and they've started to publish their findings. And what they're showing kind of across the board is that untreated hearing loss is something linked to faster cognitive decline. Um, One of the most recent studies basically found that, on that severity level we talked about earlier, a mild loss, you're about 2 times more likely to develop dementia or other cognitive issues. Once we get to a moderate loss, you're 3 times more likely. Once we get to a severe loss, 5 times more likely. So it really is kind of exponentially tied in together. Basically, more than anything, by reducing kind of auditory input, we're reducing the signals that get sent to the brain. And it kind of becomes like a muscle you haven't worked out in a long time. If that is only getting a couple little snippets a day, it starts to get weaker and weaker. And trying to fill in those gaps takes more effort. It takes more of that, like, huh, what did you say? You're putting more time and effort into basic communication. And that means there's less effort for other things, including memory, and other, cognitive process. So very basically, when we take away some of our sensory, whether that's vision or hearing or something else, it's taking away from other things that our brains are trying to keep up with. The Achieve study was one of the big ones that recently kind of hit its halfway point. We were one of the research centers at Wake Forest. A portion of our team has been working on this study for a long time. And basically, the goal was to follow a group of seniors for several years to keep an eye on cognition and how it was maturing with hearing. So they ended up with almost 1,000 participants and at several different areas in the United States. It was a super diverse population group, which was great. And what they found was for adults that were already at a risk for cognitive decline, a hearing intervention slowed down that risk of further problems by almost 48% over 3 years. So they had well, I think they called it like the healthy group, but basically a group that did not have any risk factors going on, as well as a group that maybe already had a couple things that they were working on. Maybe they were already in some memory group or something like that. And for both groups, they started working with them for hearing intervention, getting them hearing aids, working with them on auditory therapy. And for the cognitive decline group, it made the biggest difference. However, the study is still ongoing, and based on early data, they think that the hearing intervention is going to help the healthy volunteer group just as much, just over longer amount of time. So we are getting to the point where we can tell that if we kind of treat that hearing loss and give the brain a break a little bit, it's really, really helping people offload the other things so they can focus on other function. And more than anything, hearing is the gateway to communication. If we can't hear what's going on around us, whether that's a conversation or whether that's just someone yelling our name or trying to get our attention, it can become really frustrating and it can become anxiety inducing to not know what's going on and to feel like you're left out of things. And having regular communication and regular interaction, it keeps our brain active. And we continue to stimulate all the regions of the brain that we want. And, language processing, memory, all of that stuff is in a similar area. So if we can hit one, we hit a lot. And socially active people, even if that's just, I'm talking to friends or I'm just hanging out and, my husband and I are chatting or whatever, that's really helping keep the brain active and lowering that risk for cognitive decline. So the sooner that we can, notice an issue and get you kind of on a treatment path, the better. When we have someone who unfortunately, may not know they have a hearing loss yet or haven't had a chance to get treatment, they're having more of those difficulties. I mean, you can think about how many things in your day rely on hearing something, watching the TV, listening to family. And when that is hard, even if it's not impossible, if it's just hard, that takes a lot out of us. It can strain relationships with our family and caregivers because we'll have people be like, "Well, you aren't listening to me, and I didn't hear you." And those are different things, but sometimes that can, hit up against each other. Again, it can be anxiety inducing to not know what's going on. And for a lot of people, just like Shelly talked about at the beginning, it can be confused for additional memory and cognition issues. So I threw together a couple things that I've heard in clinic and you may have heard in, real life. But people will come in and when they're talking about, what's bringing you in today, they'll say things like, well, they seem distant. They seem like they're not aware of what's going on, or they've started leaving family meals. When people are talking, they just kind of go somewhere else and isolate themselves. Patients will tell me all the time, well, I can hear, I just can't always understand. It's probably because they're talking too soft or they're mumbling. And most commonly when a spouse comes in with a patient, they'll say like they don't seem to be listening to me. I have to repeat myself all the time. And while these can definitely be something that also describes, a cognitive decline, more than likely it also describes a hearing loss. So if we find a hearing loss, if we know that there's something that we can kind of fix up, how are we going to go about it? And really, the option for most people that makes the most sense is a hearing aid. Now, it's not the option for everyone, and your audiologist will obviously tell you if they want to consider something else for you. But for the vast majority of people, their hearing can be brought back into normal levels with a hearing aid. And hearing aids are both very simple and very complex. And thankfully, the side that the patient has to deal with is very simple. You've got a mic and a portion that has the actual technology in it. We take care of the rest. We get everything programmed for you. We work with you in terms of making sure that it fits well and that we get a style that you like and it has the features that you need. That's our job. You pretty much have to come in and kind of tell us what you want, and we'll take it from there. We don't expect you to know about every hearing aid on the market. That's not even remotely something that's in most people's wheelhouse. But that's what we're there for, is to give you an idea of what's available and what we think might be best for your hearing loss and your lifestyle. And one thing that has, on the complex side of a hearing aid is the technology in there is amazing. And it has come such a long way in the last just 5, 10 years. Um, Hearing aids are no longer just a volume boost. We're no longer just kind of turning it up and hoping for the best. They have advanced abilities to reduce background noise for people so that they can focus on, who they're actually speaking with. They have microphones different in each ear so that you have more directionality and are able to localize things better. They can connect to your phone or your TV or all kinds of different stuff so that you can stream things you want to listen to directly to your ears, just like if you were using headphones. Um, there is a lot of cool stuff with hearing aids that is more than just let's make it louder. So if you haven't had a chance to check out what a hearing aid does since, again, last 5 years, I'd encourage you to look again because there's some really cool stuff out there. And what we are always thinking about when we're fitting someone with a hearing aid is that we use the ear to hear, we use the brain to listen. I can do everything with the ear, and someone could still have processing difficulties, and vice versa. So we're working together. If you have a neurologist or someone else who's working with you in terms of cognition, we can get in touch and tell them, oh, well, this is what we found in terms of her hearing. This is what we're doing on our end. So we're always meant to work in tandem. So don't hesitate to, you know, tell us, well, oh, could you send these results to blank? Not a problem at all. We're super used to it. There's a couple things that the MMC has in their great little handout about hearing that are some myths about hearing aids. So I wanted to go through those in a little bit of detail because these are awesome. They're the exact things that we hear in clinic every day, and they're really common misconceptions. So I wanted to give you guys a chance to ask questions about them and for me to kind of give you the lowdown here. So first and foremost, this is unfortunately the kind of hearing aid a lot of people are familiar with or what they remember their parents or grandparents having. Um, I promise it doesn't look like that anymore. Uh, Technology again has come such a long way, and hearing aids are small, they're lightweight, they're discreet. Most of them are pretty much invisible unless you tell someone you have them on. Um, they won't really notice you're wearing one, but they'll notice the difference in your engagement. Um, a lot of people come back and tell me like, well, no one even knew I had it on, but I was able to lead book club. And I'm like, that's amazing. That's what we want. It's not meant to be something that hinders you in any way or causes, a frustration. It's meant to be an easy, I pop them on in the morning, I go about my day, I take them off at night. Another thing I hear a lot is, my hearing's not that bad. Like I can still hear enough, in some situations it's fine, in others I struggle, but And I think all of us feel that way about our health in some ways, well, let's wait till it gets bad. In this situation and many others, we don't want you to have to wait until it gets bad. We want you to be able to engage in social situations and in noisy places, um, do everything that you want to do without feeling like you have to strain or struggle. The goal is to maintain your quality of life, not just, fix something later when it gets to that point. Again, think about like glasses, if we just need readers, that's fine. If we need more intense Coke bottle glasses, we can do that too. It depends on the person, and everyone's hearing is totally different. This is a really common one, that people are kind of upset at the first at the diagnosis because they think it means that they're elderly or, that, oh, I'm getting older. And that I tell people all the time, age is a factor. It is not the factor. it's something that obviously kind of becomes something we look at with an older adult. It's not the only thing that can cause hearing loss. It's not the only thing that can cause someone difficulty with hearing. Um, it's not a sign of aging. It's a way to keep living fully. And on a personal note, I see infants in the NICU all the way to I had a 92-year-old patient this morning who was way more awake than I was. And we do everything in between. So, hearing aids is not the diagnosis for, just someone getting up there. It's really something that we deal with across the lifespan. Um, a lot of people will say that they've heard hearing aids are difficult, or that, it's something that takes a lot of time to figure out, or that it's hard to get used to. Um, Again, that definitely has been the case in the past, but modern hearing aids are designed to be easy as possible. Um, for people that have dexterity issues, the buttons and the things that you have to manipulate are larger. Most things now are rechargeable. You don't have to worry about buying and changing little batteries. You can literally just set it in a little box and it will charge up for you. Most things now are automatic, so you don't have to worry about controlling the hearing aid. The hearing aid is doing its own thing in the background. Um, this is also something we ask our patients, like, how hands-on do you want to be with this? And if the answer is not at all, that's totally fine. We can get you a hearing aid that you don't have to mess with. If you're someone that likes the tech and you want to be able to mess with it a little bit, we can do that too. Um, it's meant to be something that works with your comfort level and what you need out of it. And this might be one of the most common ones we hear is, well, my neighbor got her hearing aids and they just sit in a drawer. And while we hate to hear that, it's not the first or the last time we will, because hearing aids do take a little bit of time to get used to. And that's because, again, the brain coming into play, your brain is kind of relearning how to hear things it probably hasn't heard in a long time. Um, and unfortunately, our brains don't really like change, even if it's good change. So it sometimes takes a couple days for people to kind of go from thinking like, well, this is something to add to my routine. Things sound a little sharper, they sound a little different, to, okay, things have smoothed out a little bit and this is more natural.
And
And that
so,
takes,
go ahead. And Kendall, we always counsel people to, wearing your hearing aids a day and then skipping them for 2 days and then wearing them for 2 days. Your brain has to keep relearning, and that frustration of it sounding different becomes problematic. So we really like people to put them in the morning and keep them in all day and take them out at night every
yes,
day.
ma'am.
Yeah.
Yep, and that's what you'll hear any audiologist tell you. These are meant to be full time, not as needed. Because again, your brain needs to know it can rely on your ears. And when you're wearing them all day, it kind of falls into that pattern and it already knows it doesn't have to work so hard. If they're coming on and off and on and off, your brain's not quite sure. Does it need to be listening closely? Does it need to, So we want things to be very stable, and we want it to be something that, again, you just pop on and leave alone and just wear through your day. But, you know, people that maybe didn't get that bit of counseling or, weren't aware that that was going to be difficult at first, they can go 2 days and go, well, this is weird, and put it in a drawer somewhere. But hopefully, if you're at an audiologist office or even, with someone like Shelly at MMC, they will be able to tell you like there's a little bit of that adjustment period, but if we can just get over that hump, amazing. Once patients typically adapt into full-time use, they forget they have them on. And then they call me and say, I walked into the shower with them. Um, so that adjustment period can be difficult and it's there for everybody, but it's only a couple days. And if we can smooth through that, we will be great. And then probably the last thing that comes up a lot is that hearing aids are pricey. And you're not gonna hear an argument from me about that. I wish they were free for everyone. But when we do have to pay out of pocket or when insurance is not paying into it, they can definitely be pricey. But at some point, I tell patients that as an important investment in your life, we want you to feel safe and communicate well, and we want your quality of life to be easy. Um, it's something that is available at a lot of different price points. Again, hopefully any audiologist you're with is going to give you options for financial aid, for insurance programs. We have a whole box worth of stuff that we go through to try and make sure that you pay as little as possible. Um, we want you to hear better. Again, we don't really care how it happens. If we can get you cheaper ones somewhere else, we'll send you there. The goal is that we kind of find something that's going to work for you and that you also don't feel bad about spending the money on. And with that in mind, just to demystify one other thing about insurance, um, just straight Medicare with no supplement does not cover hearing aids. So I think some people have the opposite idea in mind that once they are on Medicare, it will be covered. Actually, the opposite. If you have private insurance and haven't retired yet, that's probably a good time to check and see if you have any coverage before you go on Medicare. Once you're on Medicare, if you have a supplement, some of them will offer partial coverage, but it varies by the provider. We will usually do our best to try and see if you have any coverage. But honestly, the best way to do that is to call yourself. Typically, if insurance is paying not a dime in there, a hearing aid can cost, between $1,000 and a couple $1,000 per ear. And again, most people need 2 hearing aids. Again, that is a scary price point up front. But again, good news with advanced technology, hearing aids last like up to 8 years at this point. It used to be, the technology was a little finicky. You wear it for a little while, it die, you have to buy a new pair. Not the case. We expect it to last at least 5, and I have plenty of patients in 10-year-old hearing aids walking around doing just fine. Um, you know, Thinking about it that way and kind of dividing it over the years, these will stay with you for a while. And it's one of the things that we tell people, like the money is not poorly spent, we promise. If you're wearing them every day, you're getting your money's worth out of those guys. And most people really will wear them until they're no longer serviceable, like till they're crumbling in our hands. And that's totally fine. Some people, you can think about it like a phone. Some people wear it to the ground. Some people are like, ooh, the new model's out, I'm gonna upgrade. Either way is fine. Um, we tell most people at our clinic, we'll keep it going for you as long as we can and as long as you want us to. So that's part of what your audiologist is meant to be, is kind of the mechanic for your hearing aids. We typically recommend an annual check-in where we do kind of a tune-up, make sure everything's working the way it's supposed to, give them a good clean, do all that kind of stuff. And we're the ones to call if something breaks so we can fix it for you. Again, you don't have to do much in this process. That's our job. As long as you put them on, we are super happy about that. And this is just for reference. Anyone watching this video later or anyone that, needs to see this page. Like I said, there are a lot of things that we can reach out to if we need additional help with financing hearing aids. Just a couple are up there on the screen, and one of the biggest ones is if the person in your life that might need a hearing aid is a veteran. A lot of times you can get really, really good coverage from the VA. And it's worth checking out because, for some people, no, but for some people, you can get them totally free. So if you're in any way connected to the VA, it's a good thing to check. And then Shelly already talked about this, but Costco, places like that, they're what we call over-the-counter hearing aids, which means you don't need an audiologist to have a diagnosis and a prescription for you. You can get something and, kind of just turn it up on your own. They have not been approved for anything more than a moderate hearing loss. And that's really because at some point we don't want them turned up to a crazy level unless we have a prescription and a diagnostic for you. So they're typically more a little bit like one size fits all. You know, you'll have a couple things you can modify, like the piece that goes in your ear can be small, medium, large. You can turn it to level 1, 2, 3. But for more precise tuning, or especially for anyone that's got a hearing loss that is more than moderately severe, we would really, really encourage you to consult an audiologist. And again, we will tell you, you know, yeah, your hearing loss would be okay for an OTC versus we would really recommend we look at a medical hearing aid for you. So it's great that those are options now, because for people that qualify for it, you know, that's a easy way to bump your hearing up a little bit. I also see there's 2 in the chat here. I'll answer the MMC one first. Is there a new model of Apple AirPods that function as hearing aids? So there, that is an OTC, an over the counter. So you don't need a prescription, you don't need an audiologist. The new AirPods 2, the ones that have the little spongy thing at the end, if you have a, I think you pretty much just need the AirPods and an iPhone, honestly. But once you have those, there's a specific mode and model that you can kind of make those into basically an over-the-counter hearing aid, and you can turn it up a little bit, turn it down a little bit. The functionality is in your hands, so it's something that you control and adjust from your phone. Again, for someone with a mild hearing loss, they're awesome, because if you already have AirPods, you can just use them for that boost too. And then Kathleen said, can you talk about how you work with people with dementia, both in auditory testing and in learning to wear hearing aids? Yes, ma'am. So we see every patient you can possibly think of. And we definitely see several patients that either have dementia or, you know, have different cognitive difficulties that they're working on. Nice thing about auditory testing is it's something that can be adapted. If we have a patient who is struggling with the testing for whatever reason, a lot of times we'll bring in a second audiologist, so someone to sit with them and kind of remind them of the protocol or what we're doing, and someone to be testing on the other side of the soundproof wall. We have different methods of telling us that you hear it. If you're not a button pusher, we have all kinds of different stuff. So we adapt to the patient and what they need. So we kind of get a good sense of what's going on and, you know, what they might need additional help with when we talk to you at the beginning. We're always happy to take suggestions or responses from caregivers. If you're with someone and you say like, well, they don't tend to like that, they might like this. Great. You know them better than we do, and we can get things set up for them that way. And when we have a patient who has passed that and has been diagnosed and we're starting to work with them on hearing aids, similar. One of the big things I do with my dementia patients is I write things down for them. So instead of kind of talking at them in a session and then, you know, hoping that all that made it through, I will write stuff out for them and say, like, this is the button to turn things off. This is the button to, you know, this is what needs to be hooked into the wall to charge it. Like, even the stuff that, you know, other people might be like, well, you're writing a little much. Well, yeah, I'd rather them skip it than not know what to do. So again, counseling and everything else we do is adaptable, and we always do our best to work with the patient that we have. So whatever is going on, we will do everything we can to make it a good experience for them and make sure that, you know, it's worn, it's used, and it's functional.
And to precede that, you know, some of the question is, you know, you come to our office, we identify there's hearing loss, and the question is, well, are they going to wear their hearing aids? I don't think they'll put them in. Like, they won't follow the directions, that kind of thing. You know, we're really good at the office at assessing kind of where someone is within their dementia kind of picture, talking to you about other things they do, other behaviors they have, et cetera, and help guide making the decision whether we feel like going the route of a hearing aid will be something that will be helpful and can help with that whole memory thing, or if it's going to be a battleground, in which case, we're not helping the situation. Sometimes we'll start with, the over the counter from Amazon or Apple or something, just to see how they do with them, because we don't want you spending $4,000 on hearing aids for something that, you're going to do the hearing aids and then they fight you on it. So we do have strategies that we work with patients and caregivers on in the office, so that we can determine, if we feel like the hearing aids is a good path to go down and consult the audiologist, or if we'll try something else first, or if we'll say, they're battling, just even getting their teeth brushed, we're not going to put another battle on your plate. So we really work with you and the patient very individualized to determine, if hearing aids are an asset or not.
And I will say again, I would encourage you, if you have the question about like, well, would he be able to even use the smaller one, or is that something that would fit well on him? Please come see us. Coming in the door doesn't mean you're buying hearing aids. We're more than happy to walk through things with you, give you a dummy that we can try on at home to, see if that is something we can work on to. I find that for a lot of patients, it's the sound quality that makes the difference that they keep it on. So usually the first, again, that adjustment period is the hardest part, just kind of making sure it's on in the morning and making sure it stays on during the day. And then usually if we can get to that point where they're noticing a difference and that it's easier for them, I have many patients where a caregiver or someone helps them get it in the morning and then helps them take it off at night. And that might be what they need. And I've also have plenty of patients that we've programmed a set of loaner hearing aids that maybe aren't the top of the line, but it at least gives them good sound quality and gives them a chance to try it. Again, we're gonna work with you and we can do a full diagnostic. And if you tell us like it's just not, something that we want to go through as a family, that's fine. We're here to help, not force anyone taping things to their head. Yeah, so I think I saw one more thing pop up in the chat. One second here. Oh, thank you, Kathleen.
We had one other question that came in with the registrations.
Sure.
And I don't know if you can answer this or if the answer is come make an appointment, but it says, I wear hearing aids and still can't hear conversations, even when someone is standing next to me. It's very annoying to not hear what is being spoken to you and hard to communicate with others. My hearing aids are approximately 3 years old. Do you have any suggestions?
That's one of the reasons we try and differentiate sometimes between a medical hearing aid and an over-the-counter hearing aid. It's just a piece of technology and it makes a big difference how it's programmed. It's something worth looking at if that hearing aid can be fine-tuned, and if it can be adjusted to better help you in those settings. And if the hearing aid you have isn't a medical device and it can't be fine-tuned in the office, we can talk about, okay, do we want to try an upgrade? Do we want to do something different? There's a bunch of things that can be an accessory to the existing device that can help in those situations too. We'll brainstorm with you. I mean, so yes, long story would be come to the office, but the biggest thing is just, if you think it's not quite working for you as well as it should, bring it to us to check. We'll tell you either way and we can go from there.
And there's one other note here. There were a few questions that I think you've pretty much covered, but someone else typed in, I just want to listen. And I wanted to just say, we see what you did there.
I think they win the question game.
Any comments?
Oh, I will say, Kathy Thomas just put in, I have to remember to clean them regularly. And that is something that we tell people as well. We can have people that come in and say, my hearing aids don't seem to be working, they don't seem to be doing the job. And it may be as simple as they are clogged with earwax and need a good cleaning. So, again, if you think there's a problem, bring it in so we can look at it. Kathy, you're right. There is some There is some minimal maintenance that we do suggest, especially if someone does have a good chunk of earwax. But thankfully, it's something that really you only need to do like every month or so, and it's a quick like changing of a piece on the hearing aid. And if even that's too complicated, we can modify a hearing aid so it doesn't even have that. So again, we do our best to make it work for you.
Kendall?
Any other questions?
Yes, Kendall, I think it's obvious that you love what you do for your career, and you've done a wonderful job in presenting this. And I think you can put guest lecturer on your resume now too. And I had one question that came up just because I saw it at the beginning. I think it was on types of hearing loss or causes, and it was tinnitus. And I wonder if there have been any advances in treatment. I know there's not a cure necessarily, but treatment of tinnitus.
Yes, ma'am.
So,
So,
2019, I'm sort of used to it at this point, but I just thought, is anything out there that maybe I should explore?
yeah, that's a great question. That is one of the most common symptoms that people come in with. Even if they don't come in saying, I have problems with my hearing, they'll come in saying, I have tinnitus. And tinnitus can come from several different places, but most commonly it tends to come from a hearing loss. We think of tinnitus as a symptom of a hearing loss, and that can be the most minor hearing loss. It can be a profound, like it can be anywhere. It unfortunately is not something that is directly related. You can have a very mild loss and really bad tinnitus and vice versa. But what we have found is that with a properly fit hearing aid, tinnitus is basically an area of cells in your ear that are not getting stimulated correctly. And when that happens, it's kind of filling in the blank a little bit. They don't have a job to do, and they are starting to kind of try and make sure that the brain gets stimulated in some way. That we don't like silence. It's going to fill it in with something.
I've never heard
If
that.
Yeah, and if we get a properly fit hearing aid on someone that basically, fixes that problem while they're wearing it and puts that brain back into stimulation level, it can really, really help with you know, noticing that tinnitus. And you're right, it's not something we say that is curable because it's normal. Everyone has it to some extent. If anyone sits in silence for long enough, they will start hearing things. Like I said, our brain doesn't like it, silence. But for the people that have started to really notice it and have started to be bothered by it, that's when I typically say it might be time to come in for a hearing test to make sure that we don't have a hearing loss that we need to address.
Thank you so much. Yeah.
I didn't want to jump in too much, but I'm Gerard Peer. I'm a
Nice
VA.
to meet you.
Huh? I'm a
Nice
VA.
to meet you, sir.
Huh? What?
Nice to meet you.
Oh, nice to meet you guys. I'm a VA veteran,
Yes,
and
sir.
I started out with hearing aids at Costco, and now the VA, God bless them, have given me wonderful hearing aids, and it's perfect unless I take them out, and then I can only hear about half of what's going on, and I put them back in. But it's wonderful. I recommend it to everybody.
I'm so glad to hear that, sir. I'm glad they were able to get you set up with a great and free pair.
Yeah,
And it was free.
yeah, it was free.
Typically, if the VA covers it, they will cover it in full, which amazing and is a great way to thank our veterans for their service. So we
Yeah,
highly appreciate it.
definitely.
Luxury.
Well, thank you so much to Kendall and to Shelly
Kendall, thank you.
putting this together.
Very
Thank you
informative.
all.
Yeah.
Thanks very much.
Thanks.
Tuning in.
Many thanks.
Thank
Have a
y'all
good
for
night.
having me. Have a great night.